nerves of the orbit. This is the eyeball. The optic nerve is attached to the posterior ball of the eye. It's not exactly to the posterior ball, but just medial to the posterior ball. This optic nerve is covered by the 3 meninges and also have a CSF, cerebrospinal fluid, surrounding it. The attachment of the optic nerve at the retina, this is the retina, and this is the attachment of the optic nerve. This is called the optic disc, which is usually concave, like that. This is the optic disc. And usually concave. It's seen by the ophthalmoscope during fundus examination of the eye, by the ophthalmoscope, so I can see the optic disc, and normally it is concave like that. The optic nerve is surrounded by meninges and CSF. So, if there is an increased intracranial pressure, patient عنده tumor, brain tumor, or brain tumor في meninges, or something to increase intracranial pressure, this increased intracranial pressure will be reflected on the optic nerve, so leading to affection of vision will be affected. Also, due to increased pressure on this nerve, this optic disc, which is concave, becomes either flattened or bulging to the inside here. Bulge or flattened, and not concave. This indicates that there is an increased intracranial pressure during fundus examination. Also, this optic nerve is crossed by the nasociliary nerve, and it also crossed by the ophthalmic artery. So this is the optic nerve, and optic nerve has no capacity to regenerate. Once it is cut, no regeneration will occur. This is the first nerve in the orbit. The second one is the branches of the ophthalmic nerve. Branches of the ophthalmic nerve. You know that the ophthalmic nerve enters the orbit. It gives 3 branches: the lacrimal nerve, and the frontal nerve, and the nasociliary nerve. And all these branches enter through the superior orbital fissure. The lacrimal nerve, it passes to supply the upper eyelid, the medial part of the skin of the upper eyelid, and it also carries parasympathetic fibers to the lacrimal gland. It carries, it is not parasympathetic, it is sensory to the skin, but it carries the fibers to deliver it to the lacrimal gland. The frontal nerve, it gives 2 terminal branches which supply the forehead and the scalp. It gives the supraorbital and the supratrochlear nerves, which supply the forehead. And this nasociliary nerve, This nasociliary nerve carries a communicating branch to the ciliary ganglia. It also gives the long ciliary nerve, which goes to supply the dilator pupillae muscle, as we mentioned. Dilator pupillae muscle. It also terminates by giving the anterior ethmoidal nerve and the infratrochlear nerve. The anterior ethmoidal, which becomes the external nasal to supply the dorsum of the nose, including the tip. This anterior nasal, which becomes the external nasal nerve to supply the dorsum of the nose, including the tip. And this infratrochlear supplies the most medial part of the upper eyelid. It gives the anterior ethmoidal and gives also posterior ethmoidal nerve. So these are the branches, or the important branches of the ophthalmic nerve in the eye. You know also there are the abducent nerve, which supply the lateral rectum, and the trochlear nerve, which supplies the superior oblique muscle. These are the main nerves in the orbit. We are now shifting to the cranial nerves. Cranial nerve will have the lower 4 cranial nerve. We'll start with the 12th cranial nerve, or the hypoglossal nerve. You know, the hypoglossal nerve is the origin. It originates from the floor of the 4th ventricle in the medulla oblongata, in the open medulla, the hypoglossal nucleus. And then it leaves the brain stem or the medulla in the groove between the olive and the pyramid. After that, it enters the hypoglossal foramen. If this is the base of the skull, lisarwingosphenoid, vitreous part of the temporal bone, and this is the foramen magnum, and this is the hypoglossal foramen or hypoglossal canal. Hypoglossal canal. So after emerging from the medulla oblongata, it passes through this hypoglossal canal, and then it enters the neck. In the neck, this is the carotid sheath, the common carotid artery. It gives the external carotid artery, and it gives the internal carotid artery. And lateral to it is the internal jugular vein. And one of the branches of the external carotid artery is the lingual artery. This is the hyoid bone. This is the lingual artery, and this is the hyoid bone, and this is the greater horn of the hyoid bone, and this is the hyoglossus muscle, and this is the tongue. Here is the lower jaw, and between it and here is a muscle. And this muscle from the inferior genial tubercle to the hyoid bone. This is the genial hyoid muscle. And this is the posterior belly of digastric muscle, crossing superficial to the carotid sheath and the external carotid artery. So, the hypoglossal nerve nucleus, it arises from the hypoglossal nucleus, which is present in medulla oblongata, open medulla, at the floor of the fourth ventricle. And it enters through the hypoglossal canal and then passes into the carotid sheath. It passes through the carotid sheath, and at the lower border of the posterior belly, it crosses the internal carotid. It crosses the external carotid. It crosses the lingual artery, and then passes superficial to the hypoglossal muscle, till it reaches the tongue. This is the internal jugular vein, and this is the external carotid artery, and this is the internal carotid artery, and this is the posterior belly of the digastric muscle, and this is the hypoglossal nerve. It passes inside the carotid sheath, and below the level of posterior belly, it crosses forward the internal, the external, the lingual artery. It passes superficial to the hypoglossal muscle to reach the tongue. While it is in the neck, it takes branches from cervical one, and these branches goes with the hypoglossal nerve throughout its course. But it joins it below the skull. So this is the hypoglossal canal. And then it enters through the neck, and afterwards is joined by cervical one. The hypoglossal nerve itself, it supplies all the muscles of the tongue. It supplies all muscles of the tongue except one muscle بس اللي هي the palato glossus muscle, which is supplied by the pharyngeal plexus of nerves. لكن كل المسلز of the tongue except the palato is supplied by the hypoglossal nerve to the main motor nerve supply of the tongue. If there is paralysis of this hypoglossal nerve, if paralysis the right side, how I can test it? If I protrude the tongue, I find the tongue will deviate to the same side of the lesion. يعني if the right hypoglossal nerve is damaged, the tongue will deviate to the right side deviation of the tongue. وده انتوا عارفين عشان الجينيو جلوسس muscle. الجينيو جلوسس muscle, it protrude the tongue and deviate the tongue to the opposite side. This is the action of the genio glossus muscle. If the right genio glossus muscle is paralyzed, so the left side will contract. It will pull the tongue forward and to the left, to the same side of the lesion. So this is concerning the hypoglossal nerve. Concerning the fibers from C1, this fiber is distributed into meningeal branch. It also gives nerve to thyrohyoid muscle, one of the infrahyoid muscles. It gives a branch to the geniohyoid muscle from C1. This is from C1, this is from C1 also, and this is from C1. It also gives the descending hypoglossi, which unite with branches from cervical 2, cervical 3, يعمل descending cervicalis. And descending cervicalis unite with descending hypoglossi to form the ansa cervicalis. Ansa cervicalis supplies all the infrahyoid muscle except one muscle بس اللي هي الثيروهيويد. which is supplied by a separate branch from cervical 1 of the hypoglossal nerve. So, the hypoglossal nerve itself, it goes to the tongue, supply all the muscles of the tongue except paratoglossal muscle. Paralysis of this nerve, the tongue will deviate to the same side of the region due to affection of the genioglossus muscle. لكن البرانشز اللي جات له من cervical 1 after entering through the hypoglossal canal in the neck, this cervical comes to descending hypoglossi, this descending hypoglossi, which unite with descending cervicalis from cervical 2, cervical 3 to form ansa cervicalis. عشان كده ansa cervicalis من cervical 1 وcervical 2 وcervical 3. 1 2 3. هذا الانسا cervicalis supply all the infrahyoid muscles. كل الانفراهيويد الاسترنوهايويد والسترنوثايرويد والاوموهايويد muscle, superior belly of omohyoid. لكن it does not supply the thyrohyoid muscle because it's supplied by a separate branch from cervical 1 through the hypoglossal nerve. Also the hypoglossal nerve is C1 fibers دهيت, it gives the genioglossus muscle from cervical 1 also. Also the meningeal branch of the hypoglossal from cervical 1. لكن purely the hypoglossal nerve supplies the tongue. This is the main feature of this hypoglossal nerve and its injury and its course. Its nucleus, how it passes through the hypoglossal canal, and then after passing in the carotid sheath, it takes branch from cervical 1. This cervical 1 supplies, as we mentioned, it gives the meningeal branch, it gives also descending hypoglossi, it gives the branch to thyrohyoid muscle, it gives the branch to geniohyoid muscle. أما الhypoglossal nerve شخصيا, it goes to the tongue to supply all the muscles of the tongue except the palatoglossous muscle, which is supplied by the pharyngeal plexus of nerves. نيجي الكرينيال نيرف الثاني اللي وراه اللي هو نمرة 11 اللي هو الاكسسوري نيرف. الاكسسوري نيرف, this is the medulla oblongata and this is the spinal cord and this is the foramen magnum. And this is the jugular frame. And this is the foramen magnum. The accessory nerve has two parts. A cranial part comes from nucleus ambiguous. This is the cranial part from nucleus ambiguous. Nucleus ambiguous, 4-7 lines, you will remember it. Nucleus ambiguous. It gives the cranial part of the accessory nerve. It also has a spinal part which arises from the upper 5 cervical segments, C1, C2, C3, C4, 5, and it enters through the foramen magnum to meet the cranial part. This is the spinal part of the accessory nerve from the upper 5 cervical segment. These two parts diverge from each other. The spinal part will pass through the jugular frame and enters into the neck again. And if this is the common carotid artery. This is the external carotid artery, and this is the internal carotid artery. And on its lateral side, there is the internal jugular vein, and this is the posterior belly of digastric muscle crossing the sheath. The spinal part of the accessory nerve, which comes from the jugular foramen, it passes through the carotid sheath and passes deep to the posterior belly. At the lower border of the posterior belly of the digastric, it passes backward, crossing in front of the internal jugular nerve, internal jugular vein. So this is the spinal part of the accessory. It passes to supply sternomastoid muscle, and then passes in the roof of the posterior triangle of the neck to pass to supply the trapezius muscle. It supplies the trapezius, and it supplies the sternomastoid muscle. So this is the spinal part. It leaves the cranial part and passes to the jugular foramen. It enters in the carotid sheath. At the lower border of the posterior belly, it passes backwards. It crosses in front of the internal jugular vein to supply the sternomastoid muscle, and then passes in the posterior triangle of the neck to supply the trapezius muscle. The cranial part of the accessory nerve, it passes with the vagus nerve. It joins the vagus nerve. This is the vagus nerve. And it passes through the vagus nerve to supply all the muscles of the larynx, with pharynx, with palate, عن طريق الفرنجيال plexus وعن طريق البرانشز of the vagus nerve. فالكرينيال بارت بتاع الاكسسوري نيرف pass through the vagus to supply the larynx. Motor nerve supply the larynx through the recurrent laryngeal nerve or external laryngeal nerve, to supply the pharynx through pharyngeal plexus of nerves, to supply the palate through the pharyngeal plexus of nerves اللي هنشرحها بعدين. So this is the cranial part and this is the spinal part. If there is an injury to this spinal part, we usually occurs in the roof of the posterior triangle. If this injury to the spinal part, the sternomastoid muscle will be paralyzed. If the right sternomastoid will be paralyzed, so I cannot rotate the eye to the opposite side, to the left side, because the right side is paralyzed. So rotation of the head to the opposite side cannot be done. The trapezius muscle, if it is paralyzed, you know the trapezius, it has an upper fibers, middle fibers, and lower fibers. The upper fiber of trapezius, it elevates the shoulder, تعمل shrugging of the shoulder. Shrugging of shoulder. Shrugging يعني يهز كتاف كده اهو. الميدل فايبر ده هي بتريتراكت الشولدر. اللور فايبر بتhelp to raise the arm above 90 درجة. فلما يحصل paralysis trapezius, shrugging of the shoulder will be lost. Elevation of the arm above 90 will be affected, not lost, affected. Retraction will be affected. لكن which is not shrugging of the shoulder, because this is made by the upper fibers of the trapezius muscle. Also drooping of the shoulder. بص الاقي الشولدر واقع, drooping of the shoulder if the trapezius muscle is paralyzed. So this is by far the commonest landmarks of this accessory nerve. It's two parts and the injury of its spinal part. because the cranial part passes with the vagus nerve. We will shift to another nerve, which is the vagus nerve. The vagus nerve, the nucleus arises from this is the medulla oblongata. There is the dorsal nucleus of the vagus, or the motor nucleus of the vagus, or the parasympathetic nucleus of the vagus. The motor nucleus of the vagus. It gives for the parasympathetic fibers of this vagus. It also takes fibers from nucleus solitarius, and also fibers from the nucleus ambiguous. And the fibers of it leaves the medulla oblongata between the olive and the inferior cerebellar ganglia. After that, it passes into the jugular foramen. This is the jugular foramen and passage of the vagus nerve. Here I will find the common carotid artery, and this is the external carotid artery, and this is the internal carotid artery, and this is the internal jugular vein, and this is the posterior belly of digastric muscle crossing superficial to the sheath. And as you know, this is the brachiocephalic artery, which gives the subclavian artery, right subclavian artery, and it gives the right common carotid artery. So the vagus nerve descends in the carotid sheath. Here in the carotid sheath, it lies in between the internal carotid artery medially and the internal jugular vein laterally. And it lies in between and in a more posterior plane. And then passes into the carotid sheath also deep to the posterior belly and passes in the carotid sheath. It descends vertically in the carotid sheath. But in the lower part of the carotid sheath here, it lies between the common carotid artery and the internal jugular vein, and it lies here in a more posterior plane. And then at the root of the neck, it crosses in front of the subclavian artery to enter the thorax, because this is the subclavian artery. It crosses in front of it to pass into the thorax. What are the branches of this internal, this vagus nerve? The vagus nerve gives the superior laryngeal nerve, and this superior laryngeal nerve gives the external laryngeal nerve, and it gives the internal laryngeal nerve. This is the superior laryngeal nerve. The external laryngeal nerve, as you know, it supplies the cricothyroid muscle, which the muscle tenses the vocal cord. So it's responsible for loud, sharp voice. And the internal, it supplies sensory nerve supply to the mucous membrane of the larynx above the vocal cord. It gives also cardiac branches to supply